Okay, we're with the part 4. In part 4, we're definitely going to talk about cylindrical component of refractive correction, testing without fog, and that's it. The Jackson cross cylinder, or also known as flip cross technique. Okay, so I know this presentation is going to be difficult, going to be so concept oriented, and I know we cannot cover this Jackson cross cylinder in about 20-25 minutes. It's impossible. So I'll definitely try to do another video series. Okay, video series in Jackson cross cylinder. I know I'll take around 5 or 7 videos for Jackson cross cylinder only. But today let's discuss about it. Okay. So basically, testing without fog means Jackson cross cylinder, which also known as flip cross technique. So a major technique which is very precise and very good technique. Definitely, it takes time. Yes, subjective refraction and subjective response of the patient. It takes time, and refinement of what we'll do, cylindrical axis and cylindrical power. Definitely axis first and power second, because we know from this formula sin square theta f into sin square theta is equal to power of CL. Do you remember this formula? If we don't have correct theta, we cannot find the correct cylinder at particular axis. Definitely. So let's take an example. If we have 0 power here and minus 1 power here, we definitely have some power, at least approximately 0.85 or whatever power here at around 10 degree or 15 degree. But at this axis we cannot find exactly correct power, because at this axis, which is at 180 degree, there is correct power, which is 1 diopter cylinder. But definitely if you miss the axis, there will be power, but it will not be correct power. That's why always cylinder axis refinement first, power refinement second. Just remember, your faculty will definitely ask you this question, which is first and why. And you must know, cylinder is axis is first and cylindrical power is second. But why axis is first? Because in wrong axis there will be a power, in wrong axis there will be a right power, basically. Which means if you find minus 1, which is absolutely correct, but if you find here minus zero point 0.9, which is also correct, because minus zero point 0.9 is good power at this particular axis, but the axis itself wrong. That's why the correct finding power doesn't matter, because you have to find first axis, then you will find the correct power, because in wrong axis you can find correct power. It's quite complicated, but you must understand this concept. Okay, okay, fine. So another point which is very important, and a few things I want to talk about it, is basically what the Jackson cross cylinder consists. It consists pair of equal power plano cylinder in opposite sign, and definitely that opposite sign ground on the different side of the same lens. For example, if this is lens, if this is front surface, if there is minus cylinder is grounded and plus cylinder is grounded here in opposite side backs. Okay, so and the axis is right angle. For example, minus cylinder is grounded at 90 degree, then plus cylinder is grounded in back surface at 180 degree. Okay, so that's the thing. And power is different. You can have plus minus 0.25 Jackson cross cylinder, plus minus this, plus minus 0.5, plus minus 1, and power increases. We definitely want the higher power Jackson cross cylinder for doing subjective refraction in case of high cylinder, or in case of low vision case. Definitely in case of low vision, you will see low vision refraction, you will use plus minus 1 diopter, because as the power increases, chances of changing of size of blood circle also increases highly. It's basically just noticeable difference. J and D increases high rapidly. So what is the principle of Jackson cross cylinder? So there are a lot of things people are saying. Let's just remember one thing. Since the construction of both minus and plus cylinder in equal power, that's why what happens if equal power? Circle of least confusion remains constantly on the same position. Many of the students say circle of least confusion remains on the retina. No, that's not correct. Circle of least confusion's position remains constant. Yes, if you understand the subjective refraction. So first remember the previous presentation. Do you remember previous presentation, what I have told you in steps all around the Jackson cross cylinder? Okay, if you don't remember this, let me remind you that what actually is the principle. First, we start with the starting point, isn't it? We start with the starting point, and second, we go for control of accommodation. Third, we start go monocular sphere, best sphere, isn't it? So what we did with monocular best sphere, we placed circle of least confusion at retina, at outer limiting membrane of the retina, at retina. And why we put circle of least confusion at outer retinal membrane? Because at that position we have best vision without correcting astigmatism. And then we come to cylindrical component of the refraction correction, testing under fog and testing without fog. And today we are in the testing without fog presentation. That's why in third steps we already put circle of least confusion at the retina. And remember, from the third step, that is monocular best sphere, I have already told you, if there is no cylinder, that's the end of the refraction, isn't it? So that's why in third step we already put circle of least confusion at the retina. Many of time you heard this principle, since it is constructed in both minus and the plus cylinder of equal power, circle of least confusion remains constantly on retina. It does it. So just understand this. But basically, Jackson cross cylinder is constructed so circle of least confusion remains constantly in the same position. It doesn't matter if you flip it or just rotate the axis, it doesn't matter. Circle of least confusion always remains at the same point. And according to third point, that is monocular spherical uh, best sphere, circle of least confusion we already placed there, because in monocular best sphere we already do visual acuity method and another is Ducombe method. From Ducombe method we know that we placed circle of least confusion at retina, which is the best place for the highest visual acuity. So that's why. And the spherical equivalent power does not change during the procedure, because the spherical equivalent of Jackson cross cylinder is zero, null. That's why spherical equivalent power does not change during the procedure. Okay, that's the principle of Jackson cross cylinder. Just remember this. Just pause this video, go again to this line, but remember this is central important. Circle of least confusion at the same position, and spherical equivalent is null, zero. Okay, that's very important point. Let's move. So just list a few more things about the construction. The red line indicates the axis of the minus cylinder, while the green or white, sometimes it's green, sometimes it's white, dot or line indicates the axis of the plus cylinder. The opposite convention prevails in UK. I don't know, maybe in UK Jackson cross cylinder. So axis can be altered by simply flipping the lens without reversing the power. Okay, so axis can be altered by simply flipping the lens, flipping by these handles, isn't it? By flipping by this handle. This is red means minus cylinder axis, this is green means plus cylinder axis. Okay, indicates the axis, not the power, because power is exactly in opposite sign. Indicate the axis of the minus cylinder, indicate the axis of the plus cylinder. Just remember this thing. So let me explain this concept. What is the principle, basic principle, and I'll definitely going to explain on other things. We put circle of least confusion at the retina in third step of monocular subjective refraction. What is the third step? That is third step is monocular best sphere. Okay. Then we have, if we put circle of least confusion at the retina, then we know one meridian focused in front of retina, that is myopic meridian, one meridian focus outside of the retina, that is hyperopic focus. Basically means two meridian straddle to the retina. Basically means two meridian, one inside of the retina, one is outside of the retina, and two meridian are equal in diopter from the retina. Basically circle of least confusion equal in diopter, not in linearly but in dioptrically equal from the retina, which is another thing. So it's central important to understand the concept of Jackson cross cylinder is whenever, doesn't matter if we are correcting the cylindrical axis, then also if we are correcting the power of the cylinder, then also what we particularly we are doing is reducing the distance between these two focal line, or increasing the distance between these two focal line. Means this horizontal axis chances it goes out, or chances of going towards the retina. Okay, These vertical chances are going out and chances are going towards the retina. If Storm's interval between the two focus shrunken becomes small. This then size of the circle of least confusion also decreases. If the Storm's interval enlarges this, then size of the circle of least confusion increases. If size of the circle of least confusion, see, position of circle of least confusion never changes. It will always be there. That's why spherical equivalent is 0. But size, that's the variable. That's very important. Size of the circle of least confusion increases if the Storm's interval increases. Storm's interval means basically distance between two foci. If distance between two foci increases, the size of the circle of least confusion increases and visual acuity decreases. We know if size of the circle of least confusion decreases, visual acuity increases because it's focus. So if in circle of least intervals, Storm's intervals decreases, basically this, then circle of least confusion size also decreases, and it means focus. And what do you mean by focus? Visual acuity increases. And that's the basic optics of Jackson cross cylinder. I'll definitely go move on. Let's move to the procedure. Okay, procedure. If the correcting cylinder minus power is used, the refraction, the axis of the minus cylinder and the JCC is the reference. That's crucial. Many of the students, many of even my students, they also fall in this trap. They don't know which um, axis should be taken as a reference. If you are putting minus cylinder to your patient's phoropter or patient's trial frame, then you should take minus cylinder axis, this is red point in JCC, as a reference. If you are putting plus component to the plus cylinder in your patient's eye, which is phoropter or cylinder, then at that particular point, white or green, that means in JCC, plus cylinder axis is a reference. And in this presentation, we take minus cylinder, which is red, as a reference, just to make it clear. Okay? So first we will definitely determine axis, second we will determine power, and determining axis, so let's discuss. So handle of the cross cylinder is made parallel to the axis of the correcting cylinder, and the power of JCC is 45 degree away from the principal meridian. Basically, if you put, let's take example, this is JCC you are putting, and you have already put, suppose example, you have already put your cylinder, minus cylinder, in this, in your eyes, then you put JCC handle exactly parallel to the minus cylinder, so that plus minus axis is there and plus axis is there. Okay, then plus is exactly at 45 degree, and we are going to flip it, isn't it? That's a simple concept. Okay, so now the lens is flipped and the patient is asked to report which of the two position is more distinct. That's the simple game. You put minus axis cylinder, and the handle should be parallel to the uh, minus axis, and then you flip and you ask the patient which position is more distinctly clear compared to one another. Okay, so combination of minus cylinder in the refractor and JCC is the net correcting axis of the power, and if I is actually minus cylinder, error is clockwise direction, the application of JCC in the minus clockwise direction will increase the clarity. Okay, let me clear it. Just leave the JCC in the same position of the patient's report clear chart and rotate the minus cylinder in the direction of the JCC towards the red line by 5 degrees. Okay, see, if you flip it, and this is the some first position, minus cylinder is here, and in second position, this is first position, in second position minus cylinder is here. Okay, if patient says the first position is more clearer and patient has minus cylinder in this axis, minus cylinder, we are taking a reference of minus cylinder, then you rotate the cylinder by 5 degrees. Okay, then you rotate the cylinder by 5 degrees. If patient is in this position, second position, it's clearer, then you rotate the minus cylinder, because minus cylinder is here, by 5 degree towards the second position. Okay, which position is clearer, then you rotate by 5 degrees. Okay. While rotating the refractive cylinder, JCC lens must be rotated to equal that amount of the red, and while white remains exactly at 45 degree and axis. means, basically means, if you rotate 5 degree this cylinder here, now cylinder is like that, then you have to rotate this handle too. Now handle is like that, because handle is always parallel to the axis, that's why. And again repeat the same thing, isn't it? With correcting cylinder in the new position, flip the lens again, correcting cylinder in the new position, and definitely handle also parallel to that position. Repeat the above procedure until the patient can do no longer tell the difference of the appearance of chart in justice flip. Until patient, and flip again. If patient tell the both direction has same visual acuity, then your game is finished. But if patient again just rotate it by, this is one position and this is second position, and many of the time called one position is good, one position is good, you go from 5 degree and 5 degree, and suddenly patient say second position is good, then you move back by less than 5 degree, let's take an example 3 degree in opposite direction. That's the concept. And the last point is definitely this: until passion there is no longer any difference in appearance of one position and two position, flipping JCC. That's finished. Let me explain by optics. Okay, it's very important that you understand the optics. See, I'll make sure that in these two slides you understand the optics basically. I have already told you that at particular this is the size of circle of least confusion. At one position this is the size of circle of least confusion which decreases basically. In third position circle of least confusion increases. At this position visual acuity drops. At that position visual acuity increase as compared to this visual acuity, isn't it? So this is the right position. We know it already from the pictures, but what actually happens is, for one position flip f1, the process lens, the plus cylinder axis white dot and JCC line may be oriented more closely with the axis of residual axis hyperopia and myopia, whereas the minus cylindrical axis may be oriented more closely to the axis of residual more myopic principal meridian, and in this position circle of least confusion reduces, visual acuity improves. Basically in this particular position, see, the minus axis is closer towards the residual cylindrical minus axis. That's the concept. Okay, see, I think you're a little bit confused, but see, whenever you put JCC there must be a residual astigmatism, because residual astigmatism means this astigmatism. Okay, so if residual astigmatism is closer towards the what actually power of the JCC. See, if minus cylinder of JCC is here and the residual astigmatism of the eye where minus power is higher. See, this is the point where, let's see, whereas minus axis red dot may be oriented more closely with the axis of residual more minus. So in this case, if it is aligned with the more minus residual astigmatism, whereas exactly more plus is aligned with this, at that particular case circle of least confusion get smaller, or the distance between two foci gets smaller, and exactly opposite happens. See, I'll just I'll just read minus cylinder. Okay, see, if this is flipped, now flipped such that the plus and minus axis reverse, the minus cylinder, see, the minus cylindrical red dot of the JCC lens would be oriented more closely to the axis of residually more hyperopic or less myopic principle, because it's opposite. At that case, the distance between these two increases. At that point circle of least confusion increases, size of the circle of least confusion increases, and visual acuity definitely decreases. The size of the circle of least confusion would increase and the visual acuity diminishes. So we know this position is wrong position and we know this position is right position, and we definitely try to shift the cylindrical axis by 5 degree approximately. Let's take example 5 degree towards this minus C position, and again we have to repeat the procedure, and that's how we correct the axis until the last position is definitely there is no difference one another. You flip the JCC. See, now we come to the determining the power of the JCC. So first you have to determine axis. Okay, so axis of JCC is placed parallel to the correcting cylinder. Now it's very interesting. See, this is the axis of the cylinder that we have found, and now we have to place exactly this axis parallel. First minus to minus, then plus to minus whenever we flipped. It's very important. In this case, see, remember, in case of axis finding, we have to make this parallel this handle to the x cylindrical axis, but now handle will be exactly at 45-degree away. Okay, that's quite interesting. The lens is flipped in front of the eye. The patient is asked to report the position to permit better vision. The game is always better vision, okay, in one position or in two position. In one position, minus x is JCC, red line is aligned with the axis of minus correcting cylinder, see. In another position, plus of the JCC, green coincide with the axis of the minus correcting cylinder. We have already considered correcting cylinder is minus, okay, in patient side. So reference cylinder is minus. If the patients prefer first position, then add minus cylinder. If patients prefer this position, add minus cylinder until equality is obtained. Until it doesn't matter when we flip minus cylinder position or flip plus cylinder position. If patient is prefer second position, then definitely the minus cylinder is overpowered, then decrease until the, if patient prefer this position, this, then we have to reduce the minus cylinder. We consider this cylinder is minus cylinder for the reference. So this is the concept. See, let me explain. At eye having with the rule astigmatism, we consider with the rule astigmatism. Why with the rule? Because vertical focus is on the myopic side, horizontal focus is on the hyperopic side. That's why it's a with the rule astigmatism. And then law with fog and under fog, definitely third step, CLC is in the outer limit in the retina, which is this position. And position A. So if we do that, it means vertical and horizontal focus are equal distance from the retina, not distantly but power. In case of equally distance from the diopter from retina, which is definitely circle of slit confusion. Okay, then let me explain position B. If JCC has been introduced with the plus axis aligned with that of the minus cylindrical axis, then astigmatism error. What happens if plus axis is aligned with the minus cylinder axis? At that position, exactly this increases and circle of slit confusion size increases. That's why vision decreases. But what happens if the minus cylindrical axis is JCC aligned with the astigmatism error? Then what happens? The circle of slit confusion gets small. So that's why in that case, circle of slit confusion gets and visual acuity definitely increases. That's the case. Okay. It's a game of circle of slit confusion size. Basically, it's a game that whether it corrects or whether not. If it is not correcting, then circle of slit confusion size increases. If it is correcting, circle of slit confusion size decreases. And we have to follow exactly same thing, whether patient says worse or whether patient says correct. Okay, so I don't know how much I am being clear, but that's the concept basically. Okay, just pause the video, read all these things. I have taken all the pictures and these things from the Boris. Go there, and I know I have to make another series of video for Jackson of cross cylinder. I think 4 and 5, 6, 7, and I have to move slowly for Jackson cross cylinder. But this is rough concept, and I think you have understood a little bit. But never say that Jackson cross cylinders principle is to put circle of slit confusion at retina, because it's not that. So we have already put circle of slit confusion at retina by unfogging and unfogging by third step of the subjective refraction. And then whenever we put the JCC doesn't change the position of circle of slit confusion. JCC only changes the size of the circle of slit confusion. See, position of circle of slit confusion constant, finished. Size of circle of slit confusion changes. Whenever size increase, visual acuity decrease. Whenever size decrease, visual acuity increase. We have to follow this. Size decrease and visual acuity increase. And then we have to understand what is the reference and which cylinder we have put to our patients. Game finished. Okay, just remember this. And just remember this picture. This is the gold, because you have to understand concept from this picture. This picture is genuinely gold picture. Okay, just this, remember this picture. Okay, okay. The last point is for each 0.5 change in cylinder in the power correction, then definitely put 0.25. Why? Because if you do this, then circle of least confusion remains at this position. The position of circle of least confusion never changes, because you increase minus cylinder, because see, this is the calculation, isn't it? Plus minus 0.50 divided by 2, which is 0. So if you add plus 0.5 cylinder, you add minus 0.25 is fair. If you add plus 0. Minus 0.5 cylinder, you add plus 0.25 is fair, to to make circle of least confusion position always at the retina. So common source of error in Jackson cross cylinder, not keeping circle of least confusion on retina, because I have already told you in third steps of our substitute refraction, it's that's the point. The starting point is wrong. Okay, so and another is forgetting the change is fair power whenever you change cylinder by 0.5. Assuming the axis is correct, if patient says that looks same. If you don't know axis is if axis is wrong, then power will definitely be wrong. Incorrect presentation of time, escaping too quickly. If you do too quickly and you didn't give patient sufficient time for subjective response, it will be definitely be error. And poor alignment of JCC and trial frame axis, that's major thing whenever I have seen my student done JCC, which is very important. Okay, the major reference is clinical refraction by Boris, which is major refraction. Yes, I have taken few for the procedures, but this is the cold, and definitely I'll going to make few videos from this in future. Bistan choose. I'm sorry, it's too long. And Bistan choose, but